I think social justice is a way of life. I think about it in pretty much everything that I do. You know, if I'm teaching, it's how am I teaching about human development, child adolescent development, thinking about social justice issues, thinking about the way that race and class and gender and sexuality and nationality and immigrant status and all of these other kinds of isms and experiences are, you know, intersecting with one another to inform a developmental trajectory of one child, for example, right? In my research, I'm thinking about social justice. I'm thinking about access to opportunities. I'm thinking about how do we change policies to be more inclusive. And so I think that, you know, people hear social justice as like, it seems like this really big thing, and it can be, you know, it can be a big thing. It can be writing legislation. It can be, you know, doing some study that shows how histories of discrimination and housing displacement have impacted, you know, the African American community in terms of all these health disparities. Like, those are all kind of social justice things. It can also be when a family member says something that you don't feel comfortable with because it's excluding a group of people, and you ask a question about it and you venture into that courageous space to have a conversation with them. That's a moment of enacting social justice. So I think that I would want to welcome people into finding those small and larger ways to kind of think about it in their own lives. And certainly that's what being in a university setting is all about. I'm a youth researcher. That's my area. I look at youth health disparities. And I came out when I was 15. I did youth organizing around LGBTQ youth rights starting at age 15. I was a youth worker, and that has been kind of a cornerstone of my own experiences and directed me to the work that I do now. And it's something I think about in everything that I do is who are the youth, where are they at the table, and how is their voice being heard? Cuyahoga County was selected as one of 4 national sites for a national demonstration project. And this is coming from the Administration of Children and Families, who know that we're not doing a great job serving LGBTQ kids in foster care, who know that our kids have worse outcomes when they leave care, have worse experiences in care, and sort of are setting them up essentially for a trajectory that's not what we want it to be. And so the government actually said, you know, we want to know more about how to best serve these kids, and Cuyahoga is one of these 4 national sites selected. So we are doing a project right now with DCFS, which is the child welfare system in Cuyahoga County, and several community partners, and basically what we're trying to do is transform the way that foster care happens for LGBTQ youth. So we know that kids who are lesbian, gay, bisexual, transgender, gender nonconforming, two-spirit, or questioning are disproportionately represented in the foster care system nationally. There's a lot of barriers to changing the system for these young folks. The first one being that we don't track data on them. It's not something that's asked about. Caseworkers or child welfare specialists don't ask young people in care about their sexuality or their gender identity or expression as just a part of the routine kinds of things that they do. So we don't actually know how many young people there are in care. And then identification is just the tip of the iceberg. We also don't know like what their experiences are with the foster families and kinship families that we have in Cuyahoga County. So we know that like LGBTQ youth face a lot of rejection from both their biological family members, but also from the foster care system. And family rejection and stigma attached to that is actually has really bad effects on kids, right, over time. And so one of the things that we're trying to do is implement services that are around family reconnection, but doing it in a way that is affirming, that's culturally sensitive to LGBTQ youth, and that is putting that young person at the center of that work. So we have a direct practice intervention where we're identifying young people's family members or fictive family, kinship providers, like any adult caregiver that the young person thinks is important to them and would like to have a relationship with. And then going through this intervention with those adult people that's really about trying to understand who that young person is as a full person, and in many cases shepherding through that coming out process and dealing with the adults' reactions to learning about the young person's sexual orientation or to their gender identity or expression.